Hi, everyone. Thanks for joining today. My name is Rosa Stalteri, and I am the Knowledge Translation Manager with CanCOVID and Real. I'm also the new host to the speaker series. Today is my first time hosting, so I'm really glad and honored to be here. And especially with this timely and really important talk that we have today with three experienced patients with long COVID. And they're here today to share with us their experience and to provide us more insight on this perspective. So without further ado, I'm just going to go and present to you the three patients. The first is Chandra Pasma. The second is Elaine McCartney. And the third is Emily Bodechon. And they all have different journeys, but each have experienced COVID symptoms for months. So we're looking forward to hearing from them today. A couple things before we get started. The first is that we ask if you can turn off your camera during the presentation, but you're also welcome to open the cameras during the question and answer period, which will be right after the three presenters present. And we also want to let you know that this will be posted onto YouTube. So consider that if you don't like to be on YouTube, if you like, you can just keep your camera off at that point. And so we'll ask the presenters to present, and then you can ask your questions. Please, you can also use the chat box to write your question. I'll be going through them in order of the times that they are asked, but also please feel free to ask the question and we can have more of an interactive conversation live. So without further ado, let's welcome the three presenters today.
Hi, everybody. Thank you for inviting us to speak today. We really appreciate the exposure. My name is Emily. I'm a healthcare worker. I work at a hospital in St. John, New Brunswick. I'm 45 years old. Pre-COVID, I was very healthy, active, and had no underlying conditions. I became sick I started showing symptoms, I guess, on March the 24th. I started with a sore throat, and a few days later, it developed into a very mild cough. And I'm fortunate that because I am a healthcare worker, I did have access to testing at the time because there were a lot of people around the same time that testing was very restricted, and so people didn't have access to tests. So I did have a positive swab on March the 30th and spent the next 2 weeks pretty much in bed with fatigue, shortness of breath, cough, and some neurological problems such as the inability to form memories, brain fog. I wasn't able to read, and I had some difficulty forming sentences as well. I did spend 2 nights at the hospital, more as a precaution than anything else because I had been symptomatic for 3 weeks and didn't seem to be making any improvements, so they wanted to keep an eye on me. While I was in the hospital, I was seeing an infectious disease specialist, and they did X-rays and EKGs, lots of blood work, and everything came back normal. There was no indication of any kind of long-term damage or serious complications. So beginning the 1st of May, once we were, my family was allowed to come out of quarantine, I tried to go back to a gentle exercise routine. I tried going back to work, and I wasn't able to work full time. I would just start working, and then I would, crash. I'd get like a couple of days in and I would have a crash where I would be back in bed with fatigue, the brain fog, and shortness of breath. The cough would come back, everything would come back. And so I was also, I worked with my employer who was very understanding, and we developed a back to work plan. So I tried, working part-time, and I tried working from home some, and it didn't seem to really make a difference. I ended up, if I did too much, then I would would crash and all of the symptoms would come back. I also during that time had really difficulty forming memories. So most of the month of June is a bit of a blur. I don't really have a lot of recollection of that time. And with all the protocols at work that were, changing very rapidly with all the COVID things going on, I had a lot of difficulty keeping up. So I needed a lot of support when I returned to work. My family doctor has been very supportive, but really hasn't been able to help me that much. He mostly just said, I don't know what to do for you, but whatever you need, I'll do it. I also have seen a naturopath, and so she has helped me with some kind of natural remedies, some supplements and hydrotherapy and things like that. One of the biggest issues that I've had is exercise intolerance. And it was only through the support groups online, such as the Slack group and the Facebook group, that I connected with some other patients who really helped me through that part of it. So I discovered that if I got my heart rate above 135, then I would sometimes experience acute symptoms such as I would be dizzy and blurred vision and ringing in my ears, but not always. And sometimes it would just appear, 24 to 48 hours later, I would end up with a crash and be back in bed sick again. So in September, I saw a respirologist because I was still having difficulty breathing. And so he theorized that it was childhood asthma that was reactivated, and that was why I was still experiencing the cough and the shortness of breath and the difficulty exercising. So he did put me on a couple of inhalers, which I'm still taking. And I've also suffered from some severe insomnia. So coupled with fatigue, it's almost like a cruel act of nature or something, because when I don't sleep, and then I can feel it in my lungs if I don't sleep. And so I now have a prescription for sleeping pills for the first time in my life. I discovered a lung rehab program through the online support community, which is out of New York City. So it's doctors who worked at Mount Sinai during the first wave, when the hospital was really overrun with patients. And they have a post-COVID clinic there, and they learned a lot about some of the long-term effects and the long-haul effects. And so they put out a free rehab program to patients who are still experiencing breathing issues. And so I followed that program for 6 weeks, which was really, really helpful, except that I then developed some chest pain, which I think came from doing too much, like too many breathing exercises and too much exercises. And when I say too much, it's nothing at all like what I was doing back in March before I got sick. We're talking like a 10-minute walk around my dining room. So, and the chest pain, I've never really been able to, I kind of had to just take naproxen and put a heating pad on my chest to resolve it. It took a few days, but I haven't been able to find really a physician who can help me kind of work through that, how to, so I'm just working on preventing it, I guess, is my strategy. And so now it's now just over 8 months since I got sick, and I would say that I'm 80% recovered. I started working full-time this week, so I have yet to work a full week of work, but I'm working on that now, and I'm learning. Quite scared to exercise, but I'm taking everything really slowly. So yeah, thank you for having us here today.
Thank you, Emily. And now we have Elaine McCartney. Elaine, I think you're on mute.
Oh, that's better. Amateur mistake, sorry. My name's Elaine McCartney. I'm 65 years old, living in Guelph, Ontario. My pronouns are she and her. I'm a retired social worker, primarily in hospitals and community healthcare settings. This was me on February 22nd of this year. I'm the one with hair. I was healthy and fit. I was at the gym 4 days a week, doing weight training and cardio. I could deadlift 100 pounds, bench press 70, and I ran 5K twice a week. I volunteered at a local hospital and had an active social life. She no longer exists. On April 4th, I noticed a headache and sore throat. After a couple of days, I developed what seemed like the worst flu I'd ever had, times 10. Crushing fatigue, concussion-like brain fog, intense sinus and nasal pain, loss of appetite, chills and sweats, and body aches and pains. I never had a fever, cough, or any respiratory involvement. On April 13th, I attended the COVID assessment center. I was refused testing, but was told by the physician that it was probable COVID. On April 14th, the next day, I was at the hospital where I was given a cheek swab, which was negative. I had a nasal swab done on negative nasal swab on May 29th. After my first test, I went online to find information about the efficacy of cheek swabs. There was nothing. But I explored and I found out about the high false negative rates for PCR testing, which really shocked me. I began my COVID education. My symptoms didn't go away, and I developed more. I Googled post-viral and discovered a world of information about what I was going through. I began reading the medical literature from the UK and the US to try and figure out what was going on with myself and with this new disease. I gathered information to pass on to my doctors, realizing they didn't always have the time to ferret it out themselves. It was not always well received. By mid-June, I was still extremely ill with more than 20 symptoms. My primary care physician was doing everything she could to rule out sinister diagnoses. Between April and June, I'd been referred to 7 specialists. I had 4 ECGs, sinus x-rays, 2 chest x-rays, head CT, and 5 rounds of antibiotics. Since I've had a full cardio workup and an ab and pelvic CT. I've had at least 13 blood draws. I also have referrals to 4 other clinics in other cities with wait times of up to 2 years. 4 neurologists have refused referrals. All testing has been negative. I'm incredibly healthy and incredibly ill at the same time with a mysterious new illness that I'm unable to prove that I have. My current symptoms are debilitating fatigue. I've been essentially bedridden for the past month. Concussion-like brain fog, including short-term and procedural memory issues and cognitive changes. That's my greatest concern. Pain, neuropathic, muscular, and joint. 8 out of 10 on a good day, 11 on a bad day. 2 pain meds failed, so I am untreated. Headaches, low appetite, loss of appetite. I've lost 20 pounds. Dry eyes and mouth, dizziness all the time. Orthostatic intolerance, likely hypotension. If I stand too long, I faint. Severe post-exertional malaise. On Canada Day, I went for a 20-minute leisurely stroll. I was down for 2 weeks. Insomnia and unrefreshing sleep. Impaired thermal regulation. Bone-deep chills, hot flashes, sometimes chills and sweats together. Light, sound, and smell sensitivity. Bladder incontinence. Heat and cold intolerance. Bradycardia. Gastroparesis, constipation, and diarrhea. Hand tremor and hypertension, and changes in my taste and smell. There are others, but they tend to be intermittent. Clearly, this virus is affecting my entire body, including my brain. I see autonomic nervous system dysfunction in a lot of my symptoms, but neurology refuses to see me. It has been incredibly difficult to be this sick and to have to advocate for myself, gather and pass on information, and to try and get the word out about this illness. I feel invisible. I'm not part of the stats. I'm not a case, and I'm not recovered. It's frustrating to read that England and the US are setting up rehab centers for people like me, while in Canada, we do not officially exist. Being continually met with skepticism because I don't have that positive test. And I keep getting worse. At this point, I meet all the diagnostic criteria for chronic fatigue syndrome and fibromyalgia triggered by the virus. But I face a 2-year wait to be seen at environmental health at Women's College. I have at least a year wait for the pain clinic at Grand River. I can't find a clinician that is willing and able to diagnose or treat these issues. My days are spent living in a twilight zone of bed and couch, mostly in the dark, often with my eyes closed. I use a walker so I can get to medical appointments, 4 this week alone. I have a bath chair so I can shower. Afterwards, I have to rest for an hour so I have the energy to get dressed. My husband has become my caregiver since I'm incapable of doing any chores, housework, cooking, etc. I have had doctors decide I am depressed since I don't fit into any of the boxes in their particular silo. I know depression from my clinical practice, and I am not depressed. I have so many plans for the future. I registered to start another degree this fall, but I couldn't do it. I want to be able to watch movies or read novels, but I can't follow the plots and can't remember the characters. I used to read the Globe every morning. Now, on good days, I can skim the headlines. On bad days, I can't even do that. I mourn my independence. There have been great gains in this experience. My relationships have blossomed and deepened. My spiritual practice has deepened and is a great source of comfort. I'm spending a lot of time meditating. I have a voice and I'm using it as I can. I've found incredible support from the online peer groups like Body Politic and COVID Long Haulers. I am the face of COVID for everyone I know, and I try to raise awareness of the disease and morbidity. Thanks so much for being here.
Thank you so much, Elaine and Emily, for providing us with or sharing us with us and helping us to build and raise an understanding, as Julia Zarb has put into the chat box there, and also to provide us both a professional and patient lens. And so I don't want to take up too much time because we have our last presenter, Chandra, and then we can go into the Q&A.
Thanks, Rosa. Good afternoon, everyone. I just want to take a moment at the start to say a very heartfelt thank you to Elaine for sharing that story. I found it very moving and difficult to hear. You know, my story has a bit of a different ending, but I realize how lucky I am that that's the case. My name is Chandra Pasma. I'm 41 years old, and I'm a researcher and a mom based in Ottawa. My whole family of 5 experienced months of COVID symptoms after first getting sick back in March of this year. I wouldn't describe the first 2 weeks of our illness as mild, although we got through them without needing any medical interventions. My 7-year-old twins and I experienced severe chest pain and coughing, and my husband, son, and I had abdominal cramps, nausea, and diarrhea. My 7-year-old son to the point that he was throwing up from the pain. On the other hand, my 9-year-old daughter seemed to be one of those lucky people who weren't very affected by COVID. She had only 1 day of fever and tiredness before seeming to bounce back. Our family had exposure to a known case, although we didn't find out about it until the 2nd week of our illness. At that point, I called our family doctor and talked her through everyone's symptoms. And she agreed that we were all probable COVID cases, but she asked us to stay home and keep managing our symptoms to the best of our ability, rather than going out to get tested. Because I have a history of multiple bacterial pneumonia infections, the respirologist on call recommended a round of antibiotics for me. It wasn't fun, but we survived the first 2 weeks. But then the symptoms didn't go away. They continued for months, which isn't to say that we all had the same experience. Within my family of 5, we had 3 different patterns of symptoms that mirror some of the different patterns that long COVID patients are experiencing. My 7-year-old twins kept experiencing the same prolonged symptoms for months. They coughed and complained of chest pain daily for a very long time. In June, more than 3 months after getting sick, Clara was still coughing so hard sometimes that she was unable to catch her breath, and there was almost nothing that we could do to help her when that happened. It wasn't until the beginning of September, when she got put on a high-dose inhaler by a pediatric respirologist, that her cough finally went away. Luke's cough and chest pain took 3 months to improve, but it took another 2 months after that for him to regain his usual stamina. My husband and older daughter, in contrast, had relatively mild symptoms that never lasted long, but their symptoms kept coming back. They would have a week, maybe 2, with no symptoms, and then suddenly a day of fever and sore throat again, or a weird rash, or dizziness and headaches, or stomach cramps and diarrhea, or swollen glands. It took them 5 months to be completely symptom-free again with no relapses. And my experience was totally different yet again. For the first 10 weeks, I had new symptoms developing constantly. One symptom would clear up and I would think I was finally done, and then another one would start. I had very intense pleurisy that involved my full chest, front to bottom, top to bottom, front to back, very swollen, painful glands. I had blisters all over my torso and upper thighs that would pop, ooze pus, and some of them turned into abscesses. I had extreme fatigue, both mental and physical, headaches, muscle and joint pain, sore throat, runny nose, burning, gritty eyes, a wildly fluctuating heart rate, which could go from too low to too high while sitting down, not moving at all, tingling in my hands and feet, and tinnitus. After 10 weeks, I was feeling better and thought I was recovered, and then the symptoms started cycling all over again. Pleurisy, swollen glands, blisters, etc. After 30 days of symptoms, I was worried I might have developed a bacterial infection, so I went to the hospital. The emergency room doctor responded like he thought the only thing wrong with me was anxiety, but he did order x-rays, blood work, urinalysis, and a COVID swab. The swab was negative, the x-rays were clear, and the test showed nothing abnormal. When I called our family doctor at 6 weeks to report that we were still experiencing symptoms, she told me they could not possibly be related to COVID because COVID didn't last that long. It wasn't until July, more than 3 months after getting sick, that my youngest daughter and I started getting referrals to specialists. But even then, while my doctor's daughter was able to help her, my doctors didn't know what to do with me. They ordered a lot of tests, but as my immunologist said, the good news is I can't find anything wrong with you. The bad news is I can't find anything wrong with you. By the end of July, I was starting to feel a bit better, although not even close to normal yet. But then in August, I had a major relapse. And by the beginning of September, I was starting to develop new symptoms of dysautonomia. My heart rate would shoot up whenever I did the slightest thing, and I would start pouring sweat at the slightest bit of stress, even things that I didn't think of as stressful, like talking on the phone. I would get a band of pain around my chest when doing the mildest things, like folding laundry sitting down. Finally, around mid-October, I started to make more sustained improvements in my health. Like my kids, I'm finding that my stamina is the last thing to return, and I think I will probably have tinnitus for the rest of my life. But most of the time, I am now symptom-free. I have no idea why all 5 of us became long haulers while others experienced very mild illnesses, but I also have no idea why all 5 of us have recovered while others remain very sick. My family's experience has in many ways been a microcosm of the experience of long haulers. The patient-led research group, a small team of researchers, data scientists, and medical professionals who are also COVID long haulers, were among the first researchers in the world to do a comprehensive survey of long haulers. They received responses from 640 patients around the globe. Their survey found that the symptoms are not just the commonly talked about symptoms of persistent cough, lung soreness, and fatigue. They cover the whole body and include cardiovascular, neurological, gastrointestinal, and dermatological symptoms. They also found that the experience of long COVID can be very serious, with some patients debilitated to the point that they are unable to care for themselves, and others experiencing severe symptoms such as seizures, clots, neurological symptoms, and neuralgias. They increased over time and are going on to recover. Others are experiencing new and more debilitating symptoms over time. Cycles of improvement and relapse are very common. And while many long haulers, especially in Canada, were not able to get a positive test due to the extreme restrictions on testing in the early days of the pandemic, the survey found no statistical difference in symptoms between those who had a positive test and those who did not. So to conclude, the experience of long COVID is diverse, and research, treatment, and therapy needs to be diverse as well to be effective. We urgently need a presumptive diagnosis of COVID to ensure that the many patients who were never tested or weren't tested on time are included in research and given access to medical treatment and therapy. And there needs to be recognition that long COVID is a condition that affects the whole body and can have a wide range of systemic effects. Thank you.
Thank you so much, Chandra. And thanks for that, providing us that research and patient lens, but also providing us some recommendations to move forward. So I'm just going to read to you some of the reactions, and then we'll go into the Q&A section. So from all three of you, we had a few reactions. First was from the Secretariat staff saying, thank you for sharing your story. We have one from Julia Zarb saying, Emily, thank you for sharing. It helps raise understanding. Kate Dainty also says, this is truly incredible. Thank you so much for all you for sharing your stories. Julia again saying, thank you, Elaine. It can be easy, but thank you for the strength and clarity of your voice. And then there's lots coming up there. So maybe what we'll do is, because I noticed the time and I'd love to read them all, but we should probably go into the Q&A session. So if anyone wants to pop in a question into the chat box, we can start that session now. Okay, so maybe what we'll do is I can share with you some of the responses. So Susan Law says here, such wonderful insights into your experiences, with many thanks for sharing. Julia Zarb, Chandra, thank you. You and Emily and Elaine have done a lot to bring your voices into science and research community. And then we have a bunch there. So maybe, we have a first question there, perfect, from Heather Orpana. She says, how would someone whose family is experiencing symptoms go about trying to determine if this is long COVID? So maybe we can get a response from all three. For this
and both after that, there's one that's up in the chat a little bit more as well.
Oh, okay, thank you.
I'll go first. So there's a couple different ways. One is serological testing, but with the caveat that there are significant limitations to it. We know that there are a number of false negatives that are possible, that the threshold might not be sensitive enough to catch people who did not have severe illnesses, and that antibodies wane after 6 months. So for a variety of reasons, you could have had COVID, developed antibodies, but they would not be caught by a serological test. But beyond that, I think there's a number of things that could be used to determine that you have long COVID, which would start with the timing of your illness. You know, for my family, it coincided exactly with the week that the global pandemic was declared. And then the correlation of symptoms, which doesn't necessarily mean all the big ones. You know, Emily, Elaine, and I all discovered last week that not a one of us had a fever. And as Elaine said, she never had a cough. So you don't necessarily have to have had one of the big ones, but in the case of my family, my son had conjunctivitis and my husband lost his sense of smell. So that was one of the things that led my doctor to say that, yeah, we were probable COVID cases. And then the third element, I think, is the pattern of symptoms following the illness. There's a number of common patterns that you see among long haulers. As I detailed, it could be the recovery and relapse, the prolonged symptoms, or the development of new symptoms over time. So I think if you add up a number of those components together, you could come to a presumptive diagnosis that somebody has long COVID.
Mm-hmm. Yeah, just to add to that, I am in the antibody testing at the CanCOVID study, but tomorrow illusions that I'm going to show positive antibodies at this point or anything else. Thanks.
So the question about, you know, how to tell if your family member has long COVID, I actually get that question a lot from people. You know, people will just call me up and ask, you know, I think I might have had it and this is what I'm experiencing now. And so I tell them pretty much the same things that Chandra said, you know, trace back to when you first got sick, were you traveling, where do you think you got it? Not that all of those things, you know, will necessarily fit the criteria, because I never traveled and I don't know of any exposure that I had. But, you know, just try to work through and then work through the presumptive diagnosis criteria that we've talked about so that, you can tell. And then the previous question about the antibody testing, I live in New Brunswick, so I haven't been tested, and that's because the serological testing is quite restricted here, and I don't fit the criteria for testing.
So I'm really realizing it's 4:31, but I'm happy to stay and also go through some of these additional questions. We don't need to have everyone on, but everyone's welcome to stay on if you have time. We can extend this meeting just a little bit further to answer these important questions, if that's okay with the speakers as well. Perfect. Okay, so we answered the question from Lloyd, which was, have you had any serological testing to cover? So thank you, Emily. And so we'll go on to the next question, which is from Charlene Ronquillo. She says, what do you think will be the most helpful for you that needs to be addressed by A, health providers, B, health policy, C, researchers, and D, the public?
That's quite the question, but I think there's some commonality, so I'll try to answer as briefly as I can. I think there needs to be greater awareness from everyone that this is a potential outcome of COVID, that it's not either recovery or death. And I think that needs to be part of the public health warning to the public, because I think that would change people's risk evaluation. And I also think greater awareness would help when we are seeking medical care, that doctors realize right away that this is a real outcome of COVID, and they won't dismiss our symptoms as anxiety or depression. There needs to be research into the causes of long COVID. Some of that I would like to see happen quite quickly. There's a number of theories that could potentially explain the diversity of symptoms, even though it's whole body. And there's existing treatments for those. So, we could have thousands of people being needlessly ill when there's existing treatments out there, but we need that research to happen quickly. And then we also need longer term research, recognizing that maybe the quick research won't have the outcomes we're looking for, and there's not one cause and it's not one illness. But what I would like to see is that happening much like the Mount Sinai model, where research is happening in conjunction with treatment and treatment and care is feeding into research, recognizing that people can't put their lives on hold for 2 to 3 years while they wait for some determination of what might be causing long COVID. They need access to therapies now very urgently.
Elaine and Emily, do you want to have an opportunity to answer the question as well?
At this point, my fatigue is so bad I don't remember the question.
I can repeat it. So the question was from Charlene Ronquillo. What do you think will be the most helpful for you that needs to be addressed by A, healthcare providers, health policy, researching, and public?
Got it. Recognition, as Chandra said. Time. And it all comes down to money. I understand the system. I've worked in it. I know how it works. It all comes down to money. I've turned to a naturopath and a functional medicine doctor that I'm paying out of pocket. She has the time to sit down and spend 2 hours doing an assessment of my symptoms and work out a treatment plan. Obviously, I can't get that anywhere else. Nobody has the time to ask why. I failed my cardiac stress test because I couldn't stand up, and I was told I was deconditioned. Why? I can't stand up. But I was told to get more exercise and move on. The why is missing in all of this. And I find that very frustrating because, everybody's under stress. Nobody has the money to do it or the time. Thanks.
So the only thing that I would want to add to that with regards to health policy would be the way that our healthcare system operates in silos. And Elaine kind of touched on that in her talk. So, I was experiencing problems, so I had to get a referral to an infectious disease specialist. And then when, he kind of exhausted everything that he could do for me, then I had to go back to my family doctor to be referred to a respirologist. And so everything just takes so long when, ideally we would have more of a patient-centered approach. We talk about that all the time, how healthcare should be patient-centered, where the patient goes in and everybody who needs to talk to them talks to them and they talk to each other. And so instead of, operating in silos and the family physician being kind of the middleman in everything.
Yeah, the Boris Clinic at McMaster is a good example of that kind of approach, and we need more of that.
Thank you, Elaine. Thank you, Emily and Chandra. So realizing the time, it's 4:36. And we're just getting something. Oh, yeah. Okay, so there's some contact information there. Julia Zarb just posted. She's the directing manager of CanCOVID. So thanks, Julia. I just want to take this opportunity to thank all of you. So Chandra Pasma, Elaine McCartney, and Emily Bodechon for providing us with an incredible and very insightful perspective to what you all are going through. And I hope that this provided, all the 50 plus participants with that insight. And it seems from the chat box, everyone is just thanking all of you for providing this. And I hope that, going forward, this will provide better perspective into what needs to be done going forward in terms of long COVID. So thank you all again. And I hope everyone has a great evening.